Hey, welcome to The Explainer. You know, we love to take complicated stuff and make it super clear. Today, we're tackling a big one, jaundice.
So let's jump right in. Why do people sometimes turn yellow? It's a pretty striking thing to see, right? And can be kind of alarming. Spoiler alert, it's not from eating too many carrots. We're going to get to the bottom of the real medical mystery here.
Okay, so to figure this all out, we've got to understand what that yellow color actually is. So for this first part, let's define what this warning sign means and get a few key terms straight. They're going to be super important later on. All right, so jaundice. It's that visible yellow color you might see in someone's skin or the whites of their eyes. And this is a really important point. Jaundice itself isn't a disease. Think of it more like a symptom, a big yellow warning sign that's being set off by too much of a substance called bilirubin. And here's where it gets a little more specific, but it's a super key distinction. You can actually have high bilirubin in your blood, that's called hyperbilirubinemia, before you ever look yellow. Jaundice is just the name for when that level gets high enough, we're talking around 2.5 milligrams per deciliter, that you can actually see the color change. So one is the number on the lab report, the other is the sign you can see with your own eyes.
Okay, so this brings us to another term, cholestasis. And this is a bigger deal. It's not just about bilirubin. Cholestasis is when the whole system for bile flow from the liver gets jammed up. I mean, it's like a major plumbing catastrophe in your body. Everything, bilirubin, bile salts, cholesterol, it all starts backing up and spilling into the bloodstream.
So, if we want to understand how things break, we first have to see how they're supposed to work, right? So let's follow the main character in our story today, that yellow waste product, bilirubin. We're going to follow its entire life story from start to finish. And that story starts right here, with this number, 120 days. That's about how long a red blood cell lives. And just like pretty much everything else, they get old, they wear out, and the body needs to recycle them. So this big recycling job happens mostly in the spleen, and this is the moment bilirubin is actually created. Old red blood cells are taken out of the system, the hemoglobin inside gets broken down, and a part of that, called heme, is turned into this yellow stuff, our bilirubin. And you know, it's not just some harmless leftover. The source material is really clear on this, saying, this bilirubin is a highly toxic molecule. Our body must get rid of it. So yeah, this stuff is dangerous, which is exactly why our body has this amazing, super efficient system to get it out. This first version of it, the toxic kind, has a name, unconjugated bilirubin. The two things you absolutely have to remember about it are, one, it's dangerous, and two, it's not water-soluble. And that second part is huge because it means the body can't just, pee it out. It has to be processed. And where does that processing happen? Well, at the body's main processing plant, the liver. The liver is incredible. It does three key jobs here. First, uptake. It literally grabs that toxic bilirubin right out of the blood. Second, conjugation. It chemically changes it, attaching another molecule to make it safe and water-soluble. And finally, excretion. It packages up this new, safe bilirubin into bile so it can be shipped out of the body for good. So this is the big transformation in a nutshell. Before it gets to the liver, it's unconjugated. That's the toxic, non-water-soluble kind. After the liver does its magic, it becomes conjugated. Now it's non-toxic, water-soluble, and totally ready to be kicked out of the body. Seriously, understanding this difference is the whole key to figuring out why someone has jaundice in the first place. Okay, so now we know how the system is supposed to work. So what happens when it breaks? Well, jaundice is what you see when this whole elegant process gets messed up. And it turns out there are really three main places where things can go wrong. And this is a really helpful way to think about it. The problem can be before the liver. This is like an overproduction issue, where the body is just making way too much bilirubin for the liver to keep up. Think of something like hemolytic anemia, where red blood cells are just breaking down way too fast. Or the problem can be at the liver. The processing plant itself is broken or damaged, maybe from something like hepatitis. And finally, the problem can be after the liver. This is a drainage problem, a blockage, like a gallstone getting stuck. The liver did its job, but the bilirubin is all dressed up with nowhere to go. This whole before, at, or after idea, that's not just for us. That's exactly how doctors start to figure things out. The yellow skin is like that check engine light on your car's dashboard. This framework is how they pop the hood and find out what's really broken. So, how do they do it? How do doctors play detective here? Well, they use a combination of clues, things they can see and things they find in lab tests, to pinpoint exactly where in the system the breakdown is happening.
And it's amazing how much you can tell from just simple observations. Get this, if the problem is overproduction before the liver, you actually get too much bilirubin in the gut, which can make stool look really dark. But if the problem is a blockage after the liver, then no bilirubin can get into the gut at all. And what do you get? That classic, pale, clay-colored stool. It's really cool, like medical detective work in action.
And of course, lab tests give them even more specific clues. If they see high levels of that toxic, unconjugated stuff, that points to a problem either before or at the liver. But if they see high levels of the safe, conjugated kind, well, that tells them the liver did its job just fine, so the problem has to be a blockage after it. And other things, like specific enzymes, act like little road signs pointing to either damage to the liver cells themselves or a clog in the pipes.
Okay, so we've covered a lot of ground. Let's pull it all together and boil it down to the most important things you need to remember about jaundice. First, remember that jaundice isn't the disease itself, it's just the symptom. Second, it's all about a buildup of bilirubin, which is just a waste product from old red blood cells. Third, the liver is the hero here. Its job is to make that waste product safe. And finally, if you see jaundice, it means something's gone wrong in that whole process. Either there's too much being made, the liver can't process it, or it's all blocked up.
And there's a quote from the source material that just sums this up perfectly. Just diagnosing jaundice is no diagnosis. A good doctor will always look beyond that. And that's really the whole point, isn't it? The yellow color is just the beginning of the story, not the end.
So next time you hear the word jaundice, I want you to think of it like this. It's the body's bright yellow warning light, flashing away on the dashboard. And the most important question isn't about the light itself. It's about figuring out what critical signal the body is trying to send.